So, hi everyone, this is Dr. Isha, your TTC companion, and welcome to this episode where we deep dive into the world of unexplained infertility. We have Dr. Karthika Kumar with us, who is senior consultant at Cimar, the Women's Hospital Kochi since 2010 and Futureace Hospital since 2024. So, if you have been told that all your reports look normal and still you haven't been able to conceive, this video is for you. So, before I start, I would like Dr. Karthika to briefly introduce herself and about her practice. Over to you.
Hi everybody, I am Dr. Karthika. I am a senior consultant working in the field of infertility for the past 15 years. And I basically focus on helping people to build their families. So today with Isha, we will be discussing about the most frustrating topic in infertility, that is unexplained infertility, where we are not able to find a cause. So we will be discussing on what we know, what we don't know, and what we can do to help you have a family. So, welcome to
Absolutely.
the chat.
Absolutely. So, thank you, Dr. Karthika, for your introduction. And we are looking forward to gain some valuable insights from you today. So, let me start with my first question. So, what exactly is this unexplained infertility? How is it diagnosed when all tests appear normal?
See, when we talk about unexplained infertility, first we should know what is infertility. So, infertility is when the couple try for 1 year
Mhm.
regularly with unprotected intercourse and they find it difficult to become pregnant.
Hmm.
In spite of doing all the routine standard fertility tests, we are not able to find a cause.
Right.
That is when we say that these people are affected with unexplained infertility. So when I say the basic standard test, it means that the woman is ovulating normally, the
Hmm.
male semen analysis is normal, there is no tubal block, the uterus looks normal, her scan is normal, and they are having regular sexual life. But still, they are not able to conceive. So
Hmm.
there is, on paper, everything is normal and clear, but then still nothing is happening. So it is the most frustrating part where we are not able to find a cause for their fertility problem.
Hmm. So can you also like elaborate what all diagnostic tests you have been, doing with your patients to know if this woman or this couple is suffering from unexplained infertility?
See, as I told, usually we start investigating the couple only when they have tried for a reasonable time. That is, if they are young people, at least 1 year we will ask them to try before we evaluate them. If
Hmm.
they are elderly or if they have irregular cycles or any previous pelvic surgeries, in those cases we might evaluate them a little earlier. So
Hmm.
the basic evaluation is basically a follicular study.
Hmm.
Then we do the semen analysis of the male
Hmm.
because infertility is usually a couple problem. So we
Hmm.
have to evaluate both the partners.
Right.
So
Right.
we see for a follicular study, we see the semen analysis as an initial evaluation. If other tests are normal, then we evaluate the tube with a basic test, with what we call the tubal test, that is the SST or the HST, which is an OPD procedure.
Right.
And we do basically a scan where we can find any big cyst or a fibroid or something which is hindering their pregnancy. So
Hmm.
these are the basic tests. Now
Yes.
all these basic tests are normal.
Hmm.
Still, the couple is finding it difficult to conceive. Then we will have to step further. We will
Okay.
have to investigate them further. There is the role of this advanced testings,
Right.
which include for the male we do a sperm DNA fragmentation where we see the semen is looking normal,
Hmm.
but the sperms can have DNA fragmentations which can affect their fertility potential.
Right.
Then we do a laparoscopy because in scan we have restrictions. We are not seeing them directly. We are seeing the images and we are learning that this can be normal. And in scan we cannot see the tubes. We are just seeing the uterus. We are seeing the ovary. So
Yes.
what we do in a laparoscopy is we see inside of the uterus directly. So
Hmm.
if the pelvic structures are stuck to each other or if there is a tubal block, then we can identify with the laparoscopy.
Yeah.
Then other advanced tests are there, but then it is not routinely done for all patients. When your initial treatments fail, then
Hmm.
you have the karyotyping, then you do a endometrial receptivity assay, you go for the immunological test. These are
Right.
not like very well established or
Yes.
routinely practiced test. But then when things don't work out in the normal way, we will have to dig further and see whether we are missing out on any minute or subtle changes which we can pick up during the other invasive or more tests which go in depth.
Absolutely. So, basis my understanding, what I feel is, when someone, a couple who has been trying to conceive for around 1 year, if they are below 30, and it is not happening for them, then we would, have some basic test. And if the reports look normal and still, it's not happening even after, trying naturally for over an year, we would call it as unexplained infertility. Is that right?
Yes.
Okay, fine. So, in your clinical experience, what are some hidden or lesser known factors that might contribute to this, unexplained infertility?
Okay, so when we talk about the hidden factors, now I told her menstrual cycles are regular. So
Yeah,
we know that she is ovulating normally, but we don't know the quality of the eggs. So
right.
quality doesn't always depend on the age. Though we say age is the main factor, it doesn't always depend on the age of the patient.
Yeah,
There can be some genetic predispositions, which on the course of the treatment or the investigations we find out.
right.
Then we know that she is ovulating, we know sperms are normal, but we don't know whether this egg and sperm is meeting inside, whether
Mm,
they are fertilizing, means they are uniting together and forming a baby, whether
right.
this baby is good, whether
Yes.
this baby is coming and getting implanted into the uterus,
Mm,
whether the uterus has the potential for implantation.
yeah.
Then we don't know whether when they're having regular intercourse, but we
Mm,
don't know whether the cervical factors, that is the cervical secretions, are allowing the sperms to surpass and reaches the uterus.
right.
We don't know whether her uterus is actually rejecting the pregnancy, which
Mm,
we call as the immunological factors. Then
mm,
there are genetic causes. See, everything will look normal. She's ovulating, sperms are looking normal, but the male or the female can be a carrier of a genetic disease. So
mm,
when they unite and then when they form an embryo can be abnormal. That may be
yeah,
one of the causes for an unexplained
mm,
infertility.
mm,
Then we come to the normal things, our lifestyle,
yes.
the routine things what we use, the pesticides, the BPA, our environmental toxins, then the chronic stress. What
Mm,
happens during stress is there is a lot of cortisol released in our body, which
yes.
can affect the ovulation. So
Absolutely.
what we usually see now is couple getting married,
Mm,
they will put a gap for a long time. They don't want to have a baby or conceive. Everybody is like seeing for their career, settle in life, and then they think of a baby.
right.
Then during the initial period, when they have a regular sexual intercourse, they try to avoid pregnancy.
Mm,
After a certain time, then they plan everything. So at this age I will finish this, at this age I will get conceived, I will deliver by this time. So everything is going according to plan.
mm,
So once they start trying, 1 or 2 months they will try, everybody will start asking, oh, long time you're trying, not getting pregnancy. So
right.
everything doesn't go as you plan, because pregnancy is always time. You have to give some time. That is why even we don't ask a patient to do any investigations or anything unless they try for some time. There are people who come to ask, what are the tests we should do before trying to conceive? So
Mm,
I tell them, you do a basic investigations and you try, because
right.
trial is the most important thing to know whether you're fertile or not.
Absolutely.
So I think most of the tests or most of the investigations or most of the treatment what doctors do today are
Mm,
just because of pressure from the patients, I will say. Because two
yes.
months they tried, doesn't conceive, then they kind of panic, they Google, they find out that, okay, your ovulation is happening, you have sex, but you are not conceiving. So it is unexplained infertility, they come running. So do
Right.
I have some problem? So
Right.
we tell them, no, see, pregnancy is time, you give time, you relax, try for some time.
Yeah.
Most of the time things happen normally.
Yes.
So
Yes.
we should give some time, and if things don't work out, see, even with 100 problems you can conceive normally.
Right.
Sometimes your papers, your results, everything is normal, still there is a problem in conception. So pregnancy is not just numbers what you see in the papers. So
Absolutely.
I think it is just wait, give it some time, but waiting doesn't mean that you waste so many years, but still
Absolutely.
you should give a reasonable time before you go for any investigations or anything.
Yes, this makes so much sense. Even in the coaching sessions, when I talk to the women, they are, they feel too stressed even after trying for 2 months. And what we have
Yes.
seen, according to the guidelines, also, any couple who is, below 30, they should ideally try for 1 year before, going for a basic checkup. But what I feel is because of the poor lifestyle and because of the work stress, which is increasing day by day, our overall health is going down. So even if
Yes.
couples are opting for a basic diagnostic checkup or basic health checkup before they're, before planning a baby, that is also a great decision by these couples. And yeah, then trying again for 1 year is absolutely a necessity, because statistics say that if a couple is absolutely healthy, it usually takes 1 year for a couple to conceive naturally, and
Yeah,
90%
because your
of the
conception,
couples, yeah,
yes, because your conception rate, if everything is perfectly normal, if female is normal, male is normal, regular sexual, like the chances of conception per cycle is only 20%.
yes,
So
yes,
that means 80% of the normal people don't conceive.
right,
That
right.
is why we ask them to wait for some time before going for any investigations or tests or anything.
Yeah, makes sense. Let me talk about, the next question. So, according to you, like, how do you approach treatment for these couples who are facing unexplained infertility? Now, do you have a specific protocol in place, or do you tailor it like case to case?
See, any treatment for that matter is individualized. It is
Hmm,
not like one treatment fits all. It
right.
depends on the couple's age, how long they are trying. So sometimes trying doesn't mean that you try only on the ovulation dates. It
Mm-hmm.
is like how frequently they are trying.
Yeah,
Then depends on their lifestyle changes. Most of them are very busy, so they usually time their sex only during that ovulation time, which again adds up to stress. So it starts from basic counseling,
hmm,
the first step, then the basic evaluation, and depending on the evaluation and what we find during their evaluation is we decide what treatment, whether they want a treatment or if at all they want a treatment, how to proceed.
right.
So if it is a younger women with all reports normal,
Hmm,
you have time in hand. So
yeah.
sometimes you go step by step.
Hmm,
Sometimes if she is coming little later,
hmm,
she has tried for quite some time, she has done basic treatments, then we might have to step up a little, and getting pregnant at the earliest will be a priority because of the age factor. So it is individualized
right.
treatment rather than one treatment fits all.
Hmm, hmm. And when you talked about this, word that little later, I also want to understand, how do you classify this little later? Like, do you conduct this AMH test, AFC? What is the criteria for you to define little later?
See, usually I don't ask patient to do a AMH test directly.
Hmm.
I do a scan myself because
Okay.
here scanning is done by the gynecologist itself. So
Right.
we get a rough assessment of their antral follicle count, which is basically the reserve of the ovary. So
Yes.
if she is a young patient and if her reserve is looking good by scan, then I don't advise them to do an AMH.
Hmm.
But sometimes I see a low reserve.
Hmm.
It is always necessary that the patient needs some numbers, because what I see in scan is just my opinion. So
Yes.
sometimes to for the counseling purpose, I need a number.
Right.
Then I ask them to do a AMH, so
Hmm.
that it is more for a counseling purpose
Hmm.
rather than using as a tool for my treatment options.
Okay.
So I do AMH routinely, especially for aged women.
Hmm.
If they are not planning for a pregnancy right now, so if they are not planning, doesn't mean that AMH is good means you can wait for longer time. It is just to counseling them regarding their age and their risk factors and all that thing. Yes, I do an AMH, but
Okay.
mostly I depend on my assessment of the antral follicle count as a better alternative to doing an AMH test.
Okay. And then you would also, move to the advanced testing options, as you said before, that, it will vary case to case. So if you feel that if someone has to go for a laparoscopy, you would advise them a diagnostic laparoscopy. If you want
Yes.
their partner to have a DNA fragmentation, so that will tailor case to case. And it's not for,
Yes.
everyone would not have a standard approach.
No.
Okay, makes sense. So, do you now? I also want to understand from you, any specific test you would like our audience to know, or any, diagnostic that you also want to recommend to these people who have unexplained infertility, and which should actually go beyond their routine fertility work.
Sorry, I didn't get your question.
Yeah. So, any specific test or diagnostic that you recommend that should go beyond the routine fertility workup?
See, again, as I told, it is individualized.
Right.
So sometimes the couple, everything is normal, but
Yeah.
then she is finding it difficult to conceive.
Hmm.
Then definitely I will want to do a sperm DNA fragmentation test to
Hmm.
know that the semen is normal. Or if she's a patient with recurrent pregnancy losses, then
Right.
definitely sperm DNA fragmentation will be one of my tests.
Hmm.
Now, as the treatment goes by, see, when we approach a unexplained infertility, when we give them a treatment option, it
Hmm.
is not like always for unexplained infertility you need a IVF.
Hmm.
Okay, sometimes it is just ovulation tracking and ask them to have a like a intercourse during that time might help.
Hmm.
Sometimes it is just giving them ovulation induction drugs.
Hmm.
Just they will be producing one egg every month. So you try to produce more than one egg. So their chances of conception increases in that particular cycle.
Hmm. Hmm.
Sometimes it is just like a ovulation induction plus an IUI where you wash and put the sperms. So
Right.
you're actually bypassing the cervical factors which otherwise you cannot diagnose. See,
Yes.
cervical factor infertility is something which we cannot diagnose with any test. So,
Hmm.
unexplained infertility doesn't mean that it is untreatable,
Hmm.
doesn't mean that you go digging for reasons you will find an exact cause.
Hmm.
Unexplained, the name itself tell you are not able to explain. So
Right.
there are currently available tests which with which we cannot sometimes identify. So we go in a step by step manner, as I said, depending again on the age of the female and their trying time and all. So sometimes an ovulation induction, sometimes add on with an IUI, and all treatment options fail, then we might have to take her for IVF.
Okay, okay. This actually makes sense. Now, last thing that I want to discuss with you is that can this unexplained infertility eventually resolve on its own, or does it always require a medical intervention? Because me being
If
a,
you ask me whether, yeah,
sorry, please go ahead.
no, no, if you are asking me whether it will resolve, my answer will be yes,
Okay.
but not for all.
Not for all. Because me being a
Yes,
fertility coach and being a fertility nutritionist, even I advise people to, at least follow a good lifestyle, follow a healthy diet for at least 4 to 5 months before going for any medical intervention. Okay. And then you
yes,
also keep on trying naturally because, once you start having a good diet, you are having a good lifestyle, your egg quality improves, your hormones get balanced. So what I feel that yes, there are certain amount of patients where we see that yes, the response is good, but there are also some patients who have been doing all these changes, but this doesn't resolve on its own. So how do you want,
yes.
define that? What can be the factors when the diet and lifestyle changes are not even working for them?
See, as I said, my answer is yes, but not for all. Now, those group include women who are elderly, more than 35 years,
Hmm.
and who have been trying for a longer time.
Right.
So they have been trying for a longer time means their duration of infertility is more.
Hmm.
Now, all the results are normal, but whether they're actually normal, like I said, semen analysis is normal, but there is a DNA fragmentation,
Hmm.
or there can be a endometrial receptivity problem. So
Hmm.
these are the things which don't resolve on its own.
Hmm.
But if she is younger patient, she
Hmm.
has a shorter duration of trying time,
Hmm.
and results are genuinely normal.
Right.
Maybe lifestyle, her change in diet, sometimes the husband might be smoking alcohol, you cut down on all that thing, you exercise, you eat healthy.
Hmm.
See, eating healthy and exercise definitely help you to improve your egg quality, sperm quality, everything. But
Hmm.
then depending only on diet and exercise will not be your treatment.
Hmm.
This, your medical treatment and your exercise, diet, everything, your physical plus medical should go hand in hand. Just
Yes.
not just that you take a ovulation induction, you're planning for an IUI and you go smoke and you
Yes.
drink alcohol is not going to benefit you. So
Absolutely.
this should go hand in hand, and certain things are changeable. You have seen, no, people who fail IVF, we
Hmm.
have been advised by the doctor to do IVF. I failed IVF, but I conceived naturally.
Hmm.
See, IVF is not a thing that we guarantee them 100% guarantee.
Yeah.
Okay, it is that to improve your chances of conception in the particular cycle.
Hmm.
So sometimes what happens is that cycle didn't work out, but she can conceive naturally.
Mm.
So it is not like a guaranteed treatment that you do this and you get pregnancy. It doesn't mean that you will not conceive normally otherwise.
Right,
So
right.
sometimes that is why I told sometimes getting that time or giving the couple that time is very important.
Hmm.
So, if the woman is aged, if there is a long period of infertility, the results are doubtful, then definitely I would start them on some treatment options along with their lifestyle changes. But
Right.
otherwise, I give them some time before jumping into any treatment options.
Yeah, yeah. Absolutely. That is, a right approach, what I feel. And as you said that, medical intervention is also necessary along with the diet and lifestyle changes. What I have seen in my coaching sessions that people have, blockages in mind. Either they just want to go for the medical intervention or they just want to stick to the, dietary and lifestyle. So there are, either black or white zones in this particular field. But what we motivate them, and what I think you also do the same in your practice, that along with medical intervention, it is also important to have a diet and healthy lifestyle so that the outcome of that treatment improves, right?
Yes,
And
and when we give them the advice, it should be more realistic. No, we cannot expect a person who is 100 kg to give them 3 months. You become 50 kg in 3 months and come.
not at all.
Impossible. So
Yeah.
sometimes you have to give them realistic expectations. You have to give them realistic goals. You
Yes.
can tell them you reduce your weight. You try
Right.
to reduce your weight, but I don't usually prolong the treatment just to reduce her weight or asking her to exercise. See, you leave her for 6 months. Tell her you reduce and come. After 6 months, she'll come with 110 kgs.
Right.
So it is like you don't you give them realistic goals and try to do the fertility treatment along with this. Sometimes the people get very motivated when they are getting a positive result.
Yes. Yes.
So
Yes.
that is also important. So counseling is the key for fertility management.
Hmm.
And I think your lifestyle plus the medicines whatever required by the patient, I think definitely it should go hand in hand.
Yes, yes. And when it also comes about the ideal weight of the patient, ideal weight matters because BMI also have a great role in fertility of any patient. But every kg matters. Every kg you lose in this journey, every inch, it is actually taking you to, balance your hormones, improving your endometrial lining, reducing the inflammation in the body. So every factor contributes equally to the success of, their fertility journeys. So yeah, I think it was great
See,
to,
and not only for the fertility treatment,
yeah. Sorry, please go ahead.
their pregnancy journey also will be better when they reduce weight, when they are healthy. See, it is not only getting them pregnant, no, you
Yeah,
have to
yeah, yeah.
take them through the pregnancy journey for another 9 months. So it
Yes.
is uh, like it will help there throughout the pregnancy journey. It will be helpful.
That's a beautiful thing you said. And, it is actually preparing them to go through this, these 9 months to nurture a healthy baby inside them and also go through a smooth delivery experience. Because what I feel is postpartum is also like really difficult with the baby. So you have to feel healthy otherwise to take care of the baby and yourself. So yes,
Yes.
starting this journey of health and wellness during, your trying to conceive journey is extremely important for women. And for males it's also important so that their sperm parameters improve, and the chances of fertilization also improves. So yeah, I think it was great to have this session with you, Dr. Karthika. We are indebted to you for sharing your expert opinion on this crucial topic which is bothering so many couples across the globe, and this video will be useful for those couples. And thank you so
Thank you.
much.
Thank you.
Yeah. Before I, end this session, I would like you to say some concluding, words for our audience. Anything you want to share?
My advice, the sincere advice for my patients will be don't wait too long, because sometimes the journey can take time.
Yes.
So, reasonable waiting time is okay, but sometimes you need to take treatment at the correct time. So, that is also important. So, I hope whoever is waiting for a baby, let them get a positive result soon.
Yeah. So sweet of you. So thank you for watching, everyone. If you would like to consult Dr. Kartika online through her hospital, you can reach out to her. Or offline, you can also consult her if you are staying in Kochi. I would share her details in the description below. Wishing you all good luck in your fertility journey. Thank you so much.